Hello guys, today we'll be talking about cholera and I'll be talking about cholera under the following headings: Introduction, Causative agents, Pathogenesis, Epidemiology, Risk factors, Diagnosis, Prevention and control, as well as treatment. What is cholera? Cholera is an acute, life-threatening diarrhea disease that is characterized by sudden onset of profuse watery diarrhea, vomiting, as well as rapid dehydration. Cholera is caused by ingestion of food or water that is contaminated by the organism Vibrio cholerae, which is a multi-gram-negative bacterium. Cholera has been responsible for several devastating pandemics, and it is still a global public health problem, particularly predominant in low and middle income countries, where access to safe drinking water, adequate sanitation, and healthcare services are limited. Cholera is known for its ability to cause severe epidemics, particularly following natural disasters such as flooding, such as earthquakes, following wars, population displacement, as well as breakdown in public health infrastructure. Without prompt treatment, cholera can lead to severe complications such as hypovolemic shock, metabolic acidosis, renal failure, and deaths in few hours. Despite the fact that cholera is both treatable and preventable, cholera still causes thousands of deaths annually, underscoring the need for effective prevention, early diagnosis, and rapid management. Let's talk about causative agents of cholera. The causative agent of cholera is the Vibrio cholera. The Vibrio cholera is the causative agent of cholera. Vibrio cholera is a curved, comma-shaped, multi-gram-negative, facultatively anaerobic organism. It is facultatively anaerobic because it thrives in the absence or presence of oxygen. The Vibrio cholera is motile, and it is motile due to the presence of a single polar flagellum. So this is how it looks like, something like this. You have this, and then this is a polar flagellum. It is this single polar flagellum that facilitates the motility of Vibrio cholera. Vibrio cholera belongs to the family of bacterium known as the Vibrio. This is the family where Vibrio cholera belongs to. The organism Vibrio cholera is usually seen in water, aquatic environments, particularly in brackish and coastal waters. Brackish waters are waters that have a very high salt content. There are about 200 known um, serogroups of Vibrio cholera. About 200 known serogroups of Vibrio cholera have been identified, but only two are responsible for pandemic and epidemic cholera, and these two include the 01 and 0139 serogroups. The 01 and the 0139 serogroups are the serogroups of Vibrio cholera that have been known to cause epidemic and pandemic cholera. The 01 serogroup is further divided into two important biotypes, which include classical as well as ethyl. Or the 01 serogroup of Vibrio cholera is divided into two recognized biotypes, which include classical and ethyl. Also, the 01 serogroup is also divided into three serotypes, which include the Inaba, Ogawa, and Hikojima. So these are basically the serotypes in which the 01 serogroup of Vibrio cholera has. We have the Inaba, Ogawa, and Hikojima. These are all pathogenic forms of Vibrio cholera. Vibrio cholera has virulent factors, and the major virulent factor of Vibrio cholera is the cholera toxin. The cholera toxin is the major and the primary virulence factor in which Vibrio cholera uses to cause its pathogenicity. The Vibrio cholera is encoded by a gene within the cholera toxin rather is encoded by a gene within the Vibrio cholera known as the CTX-AB gene. The CTX-AB gene is the gene present within the bacterial chromosome of Vibrio cholera that is responsible for encoding for the production of the cholera toxin. Other virulence factors are also present within the Vibrio cholera, and they include the toxin co-regulated pilus, also hemagglutinin, as well as accessory colonization factors. And these virulence factors are important in facilitating bacterial adherence to the intestinal walls, as well as intestinal colonization by bacteria. Let's briefly talk about pathogenesis of, of cholera. Let's talk about pathogenesis of cholera. The pathogenesis of cholera begins when Vibrio cholera enters the stomach through contaminated food or water. Usually, organisms are usually neutralized by stomach acid, which is the gastric acid in the stomach. But in certain cases, due to large infectious dose of Vibrio cholera, or certain conditions such as aclohydra malnutrition and use of antacid or protein pump inhibitors that reduce secretion of gastric acid, Vibrio cholera can survive within the stomach and then penetrates the small intestine. Once in the small intestine, Vibrio cholera penetrates the mucus layer using its flagellum. So the Vibrio cholera, once in the small intestine, it penetrates the mucus layer using its single polar flagellum. And then once it has done that, it then adheres to the intestinal epithelium through the use of the toxin co-regulated pilus. Toxin co-regulated pilus. Once in the small intestine, it uses the toxin co-regulated pilus to adhere to the intestinal epithelium of the small intestine. Once it has adhered to the intestinal epithelium of the small intestine, Vibrio cholera then multiplies within the small intestine. It multiplies and begins production of cholera toxin. Cholera toxin is produced through the activation of the CTX gene. This gene I earlier talked about, the CTX-AB gene. The CTX-AB gene is responsible for production of cholera toxin. So the activation of the CTX-AB gene causes the production of cholera toxin. Cholera toxin, once produced, activates a specific enzyme within the small intestine, and this enzyme is known as the adenylate cyclase. The The cholera toxin, once produced within the small intestine, activates this enzyme known as adenylate cyclase. The adenylate cyclase, once activated, leads to a series of biochemical reactions that cause the clinical manifestations of cholera, which include massive loss of fluids and electrolytes into the intestinal lumen, which is clinically seen as profuse watery painless diarrhea. And this diarrhea is released through stool known as the rice water stool. The rice water stool. The stool released during diarrhea. The stool released during diarrhea is popularly known as the rice water stool. And this stool principally contains mucus flakes with little or no blood or inflammatory cells. In severe dehydration cases, cholera can lead to metabolic acidosis. It can as well lead to electrolyte imbalance characterized by hyponatremia and hypokalemia, and it can also lead to circulatory collapse if left untreated. So this is basically about the pathogenesis of cholera.